Every morning, your body wakes you up with a message. Most people ignore it, roll over, drink some water, and move on with their day. But what if that dry feeling in your mouth when you open your eyes has absolutely nothing to do with how much water you drank last night? What if it is one of the earliest warning signs your body uses to signal something much more serious happening beneath the surface? Something affecting your kidneys, your heart, your brain. I have spent 12 years sitting across from patients who came to me with something that sounded small, a dry mouth when they wake up. And we uncovered conditions that had been hiding for months, sometimes years. Here is what stops me every time I think about it. Chronic morning dry mouth affects nearly 1 in 3 adults over the age of 55. And in the vast majority of cases, it has nothing to do with thirst. Nothing. And yet, this conversation is almost never happening in examination rooms. Stay with me through to the end, because cause number 1 today is something that may be sitting on your nightstand right now. It could be doing far more damage than simply drying out your mouth. If this is useful to you, hit that like button right now. It helps this reach the people who genuinely need it. Before we go through the causes, I want you to understand something most people have never been told about their own saliva. Saliva is not just water. It is a sophisticated biological fluid carrying enzymes, antimicrobial proteins, minerals, and protective compounds, working around the clock to defend your teeth, your gums, your digestion, and your immune system. When your salivary glands slow down, your mouth dries out overnight. When you are not drinking, not speaking, not doing anything to stimulate saliva production naturally. After 55, your body produces significantly less saliva. That reduction alone creates real vulnerability. Chronic dry mouth is associated with a measurably higher risk of systemic infection in older adults. Saliva is your frontline immune defense. Remove it, and bacteria gain a direct route. So let us go through all 7, from the least serious to the one that concerns me most. By the time we finish, you will know exactly what to watch for, what to say to your doctor, and what you can do differently tonight. Cause number 7 is the most common one I see in my practice, and also the most dismissed. Mouth breathing during sleep. Before you move past this thinking it is obvious, I need you to hear something important. In my clinical experience, it is nearly always a symptom of something else. When you breathe through your mouth at night, air moves directly across your tongue, your palate, and the back of your throat. That constant airflow evaporates moisture. The result is that dry sandpaper feeling, cracked lips, a thick coated tongue, sometimes a sore throat with no illness behind it. But here is the part that concerns me, far beyond the dry mouth itself. Mouth breathing during sleep is frequently driven by nasal congestion, a deviated septum, nasal polyps, or sleep apnea. And sleep apnea is not something to wave away. It is linked to a significantly increased risk of stroke. If you wake up dry-mouthed and you also snore, feel unrested after a full night of sleep, or stop breathing during the night, please speak with your doctor about a sleep study. That single conversation could matter more than you know. For those whose mouth breathing is not connected to sleep apnea, the solutions are straightforward. A nasal strip across the bridge of your nose can increase nasal airflow significantly. A humidifier reduces overnight moisture loss dramatically. Cause number 6 is the mistake I see most consistently, and it is one that feels completely logical until you understand why it does not work. Most people assume the fix is simple. Drink more water before bed. Your body does not hydrate in real time. When you drink water, it takes 30 minutes to 2 hours for that fluid to be absorbed and distributed to your tissues. Water consumed at 10 at night is doing very little for your mouth at 6 the next morning. Research shows that older adults who did not hydrate between noon and 4 in the afternoon were significantly more likely to experience dry mouth. And after 55, the body's thirst mechanism becomes genuinely less reliable with age. The solution is not more water at night. It is front-loading hydration earlier. Aim for 6 to 8 ounces with every meal. And here's a simple pro tip. Add a small pinch of sea salt and a squeeze of lemon to your afternoon water to support electrolyte balance. Cause number 5 is one that catches almost everyone off guard. Your salivary glands are not passive structures. They are metabolically active tissues that require specific nutrients to function properly at the cellular level. The first is vitamin A. This nutrient is essential for maintaining the health and integrity of every mucous membrane in your body, including the lining of your mouth. When vitamin A levels fall, those membranes become thinner, drier, and less functional. The second is the B vitamins, specifically B3 and B12. B3 deficiency directly disrupts the nervous system signals that trigger saliva production. B12 deficiency causes the tongue to become inflamed, abnormally smooth, and persistently dry. After 55, B12 absorption drops significantly due to reduced stomach acid. For sources, focus on sweet potatoes and eggs for vitamin A, and fish and dairy for B12. For many adults over 55, supplementation is also necessary. Cause number 4 is the combination I take most seriously. If you are waking up with a dry mouth and you are also getting up to use the bathroom more than once during the night, that pairing is a clinical warning I do not ignore. Together, those are among the earliest signs of uncontrolled blood sugar. When blood sugar climbs, the kidneys work overtime to filter the excess glucose. To do that, they pull water from the body's tissues, dehydrating you from the inside out. What makes this so important is the timeline. I had a patient, a retired woman in her early 70s, who mentioned the dry mouth almost as an afterthought. We ordered a fasting blood glucose panel. Her results came back elevated. She had type 2 diabetes. Within 4 months of dietary changes, her fasting glucose had normalized. She told me, "I finally feel like my body is working with me again." That is what catching something early looks like. Not a crisis, an opportunity. Ask for a fasting blood glucose panel. Cause number 3 is a condition affecting millions, and yet the average patient waits nearly 3 years for a diagnosis. The condition is called Sjogren's syndrome. It is an autoimmune disorder where the immune system targets your glands. The result is persistent dry mouth, chronic dry eyes, and difficulty swallowing. Women over 55 are disproportionately affected. Why does it take so long? Because each symptom gets treated in isolation. No single doctor connects the dots. The diagnostic clue is this. If your dry mouth is accompanied by eyes that feel gritty or burning, ask your doctor about Sjogren's syndrome by name. A blood test measuring 2 specific antibodies can identify the condition in most cases. There is no cure, but there are effective treatments. And for immediate relief, sugar-free gum containing xylitol is one of the most accessible tools. It stimulates saliva production and inhibits the decay-causing bacteria dry mouth encourages. Cause number 2 is not one most people would ever connect to a dry mouth, but the link is real. Your salivary glands are governed by the autonomic nervous system, the branch that oversees rest, recovery, and digestion. When that system becomes compromised, salivary activity declines. What makes this significant is that autonomic nervous system disruption is a recognized early feature of certain neurological conditions, including Parkinson's disease and Lewy body dementia. I had a patient, a retired man in his late 70s, who had mentioned a persistent dry mouth. Then his wife mentioned that he had stopped recognizing the smell of his morning coffee. It was not unrelated. I referred him to a neurologist. Imaging confirmed early Parkinson's disease. Because we found it early, he was able to begin neuroprotective therapy. 3 years later, his quality of life remains genuinely good. Nothing is too small to bring up. Your body is always communicating. If your dry mouth is persistent and you have noticed a reduced sense of smell, changes in handwriting, or a subtle tremor, please bring all of it to your doctor together. The pattern matters. Our job is to learn how to listen. And now we reach cause number 1, the cause I encounter most frequently in my practice, the one that is most consistently overlooked. Over 500 commonly prescribed medications list dry mouth as a side effect. Over 500. The drug classes most frequently responsible include antihistamines, antidepressants, blood pressure medications, and bladder medications. For adults who take 5 or more prescriptions daily, the cumulative impact on brain health can be profound. There is a concept in medicine called anticholinergic burden. This is the cumulative effect of multiple medications that block a key neurotransmitter called acetylcholine. High anticholinergic burden has been linked to accelerated cognitive decline. I had a patient, a retired man in his mid-70s, who described feeling like he had swallowed chalk. A medication review identified 2 drugs with overlapping effects. We made substitutions. Within weeks, he noticed the difference. He told me, "I wake up feeling like a normal person again, and my thinking feels sharper." Write down every medication you take and bring that list to your doctor. Ask directly, do any of these suppress saliva production? And is there an alternative? Here is your action plan starting tonight. Stop any over-the-counter sleep aid containing diphenhydramine and replace it with melatonin at 0.5 to 1 milligram, a far gentler alternative. Run a humidifier tonight. Front-load your hydration through the afternoon, not the evening. Brush with a fluoride toothpaste formulated for dry mouth before bed. And try a nasal strip tonight. Then this week, bring your medication list to your doctor. Ask directly, do any of these suppress saliva production? And is there an alternative? You are not broken. Your information has simply been incomplete. And starting right now, that changes. Share this with someone you care about. I want to hear from you in the comments. Which of these 7 causes surprised you most? Remember, aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.